Hi, everyone, and thanks for joining us for today's ClinicTracker Community Training Series. We're going to be discussing ClinicTracker front office workflows or processes. Before we dive into that topic, I do like to introduce myself. My name is Alicia, and I like to explain why we have these webinars. So the purpose of these webinars, of course, is to give you access to product experts like myself on a frequent basis so that you can talk through your specific needs within the system. Okay, so we scheduled this training because a lot of you were asking for front office training. Toward that end, we would also ask that you send in additional webinar suggestions or requests. So if you need training on specific things, please send in a support ticket. You could send it through the questions panel in the GoToWebinar screen there if you need additional webinars added. Okay, so like I said, this one was added in response to customer requests. Okay, we also open the floor at the end of the topic so you can ask any system-related question. So if you're not comfortable sending in a ticket or calling in on the support line, you want to just ask on one of these webinars, you could come wait till the end, and then we'll be happy to walk through anything you have questions on. Okay, with all that being said, my goal is to make sure that you have all of the information you need about today's topic and any of the questions that you ask at the end. So toward that end, it's really helpful for me if you ask a lot of questions as we're going through. But if you have a specific scenario you want to talk through, I can unmute you. Just raise your hand using that GoToMeeting tool that says, raise your hand. That's going to allow me to unmute your microphone and we can just talk through what you need. Okay. If instead you'd prefer to type in your question, please use that questions panel. And of course, you can use the chat window as well. Okay. Now, before we get started, I do like to mention that we have an upcoming webinar. So I'll post that registration information in the chat window. So you'll see that link. It's May 20th. And we're going to be doing a tour for clinical staff. Okay, without further ado, we'll dive into today's topic, front office. Again, please ask questions as we go through. I want to make sure we're clear on everything. And before we dive into the system, I just want to talk about a few tips and tricks for the front office staff that I found helpful throughout the years. Okay, so those include bold red fields. So bold red fields are required. You cannot save or print a record until these fields are filled in. They'll actually turn black once you add a value. Okay, so you'll see that as we're going through the new intake process. Okay, F2 is your friend. This is a really good tip. I encourage you to share it with your clinicians as well, your providers. But front office also, this is helpful. This is going to search drop-down fields. So if I press F2 from any drop-down field in the system, it's going to allow me to search whatever's in the list for that drop-down. So that kind of helps me if I can't scroll through this giant list. I myself have a hard time kind of making out the list values if there's a really, really long list. So I find this F2 is really handy for me personally if the list is very long. Okay, it also from text boxes is going to access your common phrases. So that's any text box in the system, demographics form, any forms that your system admins have created for you. That F2 from a text box is going to access your common phrases tool. That tool is going to allow you to have blocks of information saved. So let's say you're filling out a request, an authorization request, and you say like one of 5 different things. You could save those in your common phrases tool and then just pick up one of those 5 things instead of typing it out each time. Okay. Quick links, Quick links is going to allow you to access forms you use often instead of navigating manually. You can just add them to your quick links. I'll show you how to do that. Okay, next we have use advanced find to locate clients. This is really handy if you don't know the client's last name or you're not exactly sure how to spell it. Okay, we can search by the client's first name, their insurance policy number, all kinds of things. I'll show you that. Quick info, that screen is going to allow you to see a summary of the client's information. So I'll show you that. use the navigation menus to move from form to form. This is going to allow you to move throughout the client's record without having to reselect their information every time, their name every time. Okay, so it saves you a couple clicks. Action menus, these are just shortcuts to things that we think make sense to do next on the form you're working on. Staff task dashboard to see what's assigned to you. So in your system, you may have tasks that are assigned to you. You're going to see those in your staff task dashboard. Okay, any questions before we dive into the system? Go ahead and raise your hand. Okay. Okay, so before we even get started, I want to acclimate everybody to this main screen. The very first thing I'd like you to notice is that up here in this upper right-hand corner, there are links to different things. So there's a link to the user portal, which has all kinds of information. Okay, some of that information includes standard workflows like I'm going to be covering today. So if I scroll down on this left side on the user portal and I go to standard workflows, you're going to see things like the new intake process and scheduling intake appointments listed out here. We're going to be going through these today as part of the front office training. Excuse me. If you click on these links, it gives you step-by-step instructions to these processes. Okay, so if you want to print these out or save the link so you could kind of move through the process after today's webinar, you can locate it very easily that way. Okay, I'm also going to make sure that we post this link when we post the webinar recording. Okay, coming right back to the system. The next link over, you'll see it says submit ticket. You can do that from right here or from the user portal. I'll just toggle back and show you this little support button on the side. Okay, if you have questions, you're getting frustrated, you don't know what to do, please just reach out to us through these support links, or you can give us a call. Okay, if you need to give us a call, I'll just show you that. Excuse me, right over here. Here is our support line. I'll just pause here. Phone support, I'm just highlighting it for you so everybody can take it down. Okay, and you can reach us at this phone number if you're more comfortable than sending in a support line, a support ticket through this tool here. Okay, sometimes it's easier for you to talk through a question as opposed to sending in an email or written response. Okay, next on the list, we'll come over here to the left. These are our navigation buttons. Okay, so on here, mine are all kind of a solid white label. That means I have full access to all areas of the system. You may have an italicized button or a grayed out button. That means you have a different level of access, okay? So it may be read only, or you may have no access at all, okay? Everyone will have access, though, to this quick links, and this is one of our helpful tips. Use the quick links button to access forms that you use often. So as you're getting trained in your clinic specific workflows and specific needs, you may find that you're going to certain parts of the system really often. This quick links is specific to you, so you can come in here and place a checkbox next to any of the forms you want to access very quickly. Okay, so I'm just going to say this admission note, for example, is one of the ones I want to access very quickly. And then I want to add in a hyperlink. Whoops, let me just save this. And then I'll add in a hyperlink. This is where I could say I want to be able to go to help.clinictracker.com very often. Now, you may put in an insurance portal because you're sending in authorization requests or logging in to do a deeper dive into insurance benefits. Okay, what you'll do here is you'll just type in your link or copy and paste it in. So in this case, I might do like http, etc.clinictracker.com. Okay, and then you can, of course, paste in your link as well, and then you save. I'm going to come out of here without saving. Oops. Okay, well, I did save it. So you'll see that they're just added in here, and then we can save our changes. Once that's in here on the main screen, you'll notice that Now I just click on quick links and I can jump into those forms or jump to that link if that had been a valid link. Okay, if there are any questions here, let me know. Otherwise, we'll keep moving. Let's keep talking about these navigation buttons. We have clients. This kind of brings you into basic areas of the client's record. So things like the demographic record. Now your clinic may have renamed this. It might say something like client info or patient info. In the demo system that I'm using, it says demographic information. This form is where we enter the new referrals, new intakes, new clients, okay, depending on what your terminology is. Okay, so everybody gets entered into this demographic form. From there, you can start entering things like the client contacts, which are appointments or collateral notes. So basically the client's treatment history is going to be recorded on the client contact form. Okay, now on the client contact form, that's where the clinician's going to attach their progress notes. You'll see that as we go forward. Okay, we also could access group appointments, so that's when the clinicians or providers are meeting with multiple people at once. Okay, we have related documents. This is where you're attaching things to the client's record. So these are forms outside of ClinicTracker, like if they had a treatment plan from an old system and we scanned it in as a PDF, we could attach it here in related documents. Oh, Sheila, thanks for your question. So Sheila's question is about this quick links, and I really appreciate this question, Sheila, for a couple of reasons. Number one, it's a great suggestion, but number two, I appreciate that because I would love everybody to see how open to suggestions that we are about the system. So if you, what you'll hear in a second is Sheila had a suggestion about making the quick links better for their specific needs. Okay, and so what I would like everybody to take away from this is we want to hear those suggestions. If you're doing something and you have a suggestion on how we can make a tool better or more efficient for you, we want to hear that. Just send it in through a support ticket or give us a call and we'll take it and we'll send that over. But Sheila's question is, can we add billing tracker forms in here? So that's a question that I'll submit to the development team and we'll review that and see if we can do that for you. Thanks for that, Sheila. I really appreciate that. If anybody has other questions or suggestions as we're moving through, I'd love to hear them or read them, as it were. Okay. We'll keep moving. Related documents I covered, that's external. I'm going to skip over eForms. That's a tool we don't really use anymore. Most people aren't using Foster Home, so I'm going to skip that too. We have external contacts. These are people that we can add into the system that might be part of the client's treatment or an emergency contact, but they're not a patient in the system. Okay. And then we do have the care quality patient query. We're not going to cover that today, but that's just a tool we can use to sync up with things like the patient's treatment history. Okay, I'm going to keep moving. We also have the paperwork menu. Yours may look different. This is just the way mine is organized. Your clinic can organize its menu in any way that it kind of sees fit. Okay, you'll be able to access any of these paperwork items provided you have access to the paperwork area. Melody, thanks for your question. This webinar will be recorded and you'll be able to access that link. I'll make sure somebody sends it to you specifically. Okay, if anybody has trouble accessing the links, just send in a support ticket. We're happy to point you in the right direction. Okay, so here paperwork, you just click on any of these items to access it. Your clinic will have different paperwork based on your specific needs. So toward that end, I'm going to let the internal trainers kind of speak to what paperwork items you'll need to be accessing. That being said, I will show you how to send patient portal form requests and that sort of thing today. Okay, compliance, we're going to skip over. We don't really cover that too much in the front office training. That's where we're keeping patient paperwork, due dates, that kind of thing. Okay, staff, this is where we can access staff records and staff forms. If you have access to this area, you might need to fill out, you know, like an incident log if something were to happen internally and you just need to record it, something like that under the staff record. Utilities, there's all kinds of things in here like being able to customize your personal paperwork menu. if you want to change it from what the global view is and you only want to see the forms that you specifically need and nothing else. Okay, reports if you have access, and then finally billing tracker. Okay, I'm going to keep moving. I don't see any additional questions, but if you have any, please feel free to shout them out. Okay, and I'm coming right to the middle. We'll talk about these widgets very briefly. Okay, we're going to spend some time here on the My Clients widget. You'll notice that there's different views, starting with this quick list. So what you're noticing is we're trying to give you quick access to areas of the system or information that you might use. So in my case, I just have Andrew on my quick list. I don't need to access that many patients quite frequently, but in this case, I have a problem with Andy's record. And so I'm trying to work that out. So I keep them on my quick list until that's figured out in my scenario. Okay, clinicians might have a different use case for using this quick list, but at the front office, that's usually what I'm seeing. Okay, you can add people to your quick list right from this widget. So you'll notice there's also a recent list. The system keeps this for me and it tells me the last time I accessed the record. Okay, from here I can right click and say add to quick list. So I can add any clients right from here. I can also navigate. Okay, so this is one of our tips and tricks. Use the navigation menu to move through the client's record. It's easier than kind of coming over here every time you want to change what you're looking at for a client and then having to reselect their name. Okay. Over here, you'll also notice there's some assigned and supervisor views that I have. That they probably won't pertain to you at the front office. You'll most likely use just these two front views. Okay, this widget also has this little plus button. Okay, and right now I'm actually going to press it so you can see what it does. This is add new patient, which accesses that patient demographics form I spoke of earlier when we talked about the first menu under the clients area. Okay, so under the clients area or right from this widget, we can enter a new intake. So let's say you're working the front desk and the phone rings and it's a new referral. Okay, here I'm going to put them into an intake status. That's the status that ClinicTracker uses before the client is what we would say formally admitted or enrolled for ongoing treatment. Okay, we can later change that status to trigger paperwork due dates and things like that. That usually happens after the first appointment. Okay, so for now, we'll leave that in an intake status and we'll come through. I'm going to skip over everything that's not required. Okay, and I'm going to come right over here to the mental health and substance abuse. Your clinic may or may not have these options, but I can say, what kind of referral is this? Is this for ongoing therapy? Is this for substance abuse treatment? Is it for both? Okay, and I can say which one is primary. Okay, up here I can say what kind of service are they coming in for. Your clinic may have different options. Mine just has the one. Okay, and I can say what their primary place of service is. You're noticing that these bold red labels are turning black as I'm going through. You'll also notice that the save and print buttons are grayed out. I'm not going to be able to save or print, so we talked about that under tips and tricks. Okay. Okay, now I'm going to move to this next tab where there's more required information. I need to fill out things like the patient's last name. So I'm going to say his last name is Webinar and his first name is Jim. Okay, and I'll say that he is a male and today's his birthday and he was born in, we'll say 1977. Okay, I'm filling out the required fields so that we can kind of move through this quickly. You can come in here and kind of explore. For the address, I'm just saying unknown. I don't know his address right now. I'll get that from him when he comes in. Okay, and then I can say I don't know his phone number either, but he's going to call me. They're just calling in the referral for right now. Okay, this is where I could say, you know, this is all the outside provider information, or I could collect it later. Nothing's required, so I'm going to keep moving. I'm going to fill out the payer information. So we'll say it's self. And then here under financial, I can fill out information. And then finally, I have this, what we call embedded form, and it has a required field. So this is just a custom tab I have in here. Your clinic probably doesn't have anything like it, but they may have something of their own. Okay, and if you see any red labels on there, you're going to need to fill them out. So I'm just going to fill this with some test data. We'll go ahead and save. So you see, now that all the requirements are filled out, that save button is now available. So I'm clicking there. Okay. Now, one thing I didn't show you oops, excuse me, we'll do this patient portal account in a second here. One thing I didn't show you as we were moving through on this date field. Okay, some people are like me, they use their keyboard as opposed to clicking with their mouse. So I just like to mention when you're using a date field, you can tab in, use your space bar to select or deselect the date. So I'm just pressing my space bar and you see what happens. Okay, now you'll see that the 5 is highlighted in blue. That means I'm on the 5. So if I wanted to change it, this is where I could kind of come through and press the up or down button. Okay, so I'm just pressing up or down and I'm changing the numbers here. Okay, so I'm moving left and right using the arrow keys, up and down to change the value. Okay, and then you can tab out to the next field. Okay, now after you create the client information, it is best practice to get an email address before you create the patient portal account. So in this case, we'll just say it's test@test.com. Okay, now usually speaking, we'll have the system create the patient portal account automatically. If your clinic isn't doing that and you need to manually create the patient portal account, you can come right down here where it says patient portal account. Okay, and then you'll see that it kind of just fills in the username for me. It has the access level defaulted, and then I can just save right here. Okay, you'll notice that it just prompted me that he doesn't have an email address entered. So I'm going to come back here and save this first because I did enter the email. And now I'm going to say, yes, I do want to create that patient portal account. Now that it's saved with the email, you'll see the emails filled in. Okay, and I can save this. It's going to send an email notification to the client's email address. Okay, and you can see I've used this email before. Okay, and that just allows the client to access anything that we've indicated here right through the patient portal. Now, let's say that you have to now manually send a form request, like for a release of information or something along those lines. You can come here and say request forms. Now, again, this is one of those things that I would prefer to automate, have your system administrators work with us to automate these tasks so you're not manually doing them. But if that's not set up yet, you can just still do this manually by selecting what you need here. I'm going to say release of information. This is a template that will come to your systems in the future. It's something I'm still working on. But this release we'll use for right now. I don't have any previous versions for this client for him for them to update. So I'll just say create new. And then we'll save and notify, which just sends a notification to the client at whatever email address they have on file, saying you have a form request, please log into your patient portal to complete it. Okay, now I know I went a little bit fast, so I'll just kind of summarize once again what I did right from the demographics. Okay, so from the demographics form, I'm coming here to patient portal account. Make sure you save everything first. So click here, patient portal account. Okay, it automatically had the client's info loaded. Because it's already saved, I just double clicked it over here in the list. And then I just click saved right here. Then I requested the forms by selecting the form here. Okay. And then I click save and notify. Okay, I see we have some questions. Can the patient send messages about their appointments and medications with the front office staff, therapists, and doctors? They can, and there's an option to limit that to only who's assigned to the staff, or sorry, to the patient. So that would be only those providers or staff who have active staff assignments, plus anybody who's indicated as a general recipient. So if they're just sending a general message saying like, I need to cancel my appointment, you could have your entire front office set up to receive those messages right on the staff info form. Okay, let me know if that answers that question. Can the patient schedule or change their appointments from the portal? Yes, if you have that enabled. So your clinic has to have that feature enabled. And yes, the patient can do that. Can more than one client use the same email address? Yes, more than one client can use the same email address. However, when they log in, it's going to be like a linked account situation. So one would be the patient account, and one would be more like an authorized user, and then vice versa. Okay. Okay. Last question I have here. If a client uses self-registration through the agency portal, how will this process different? That is a great question. Thank you so much for that. When the client when the client registers through the patient portal, what's going to happen then is you'll get a notification here that says somebody has registered. Okay, and it looks like I don't have any. Okay, and then the question before was about if the client sends in a message about, their bill or just a general message that's going to come here to the patient portal messages. Okay, patient portal registrations will come to the messages, and then you'll be able to click on a link that brings you right into that client's demographic information. So I just right-clicked, and I'm kind of pretending we got this through the portal. Okay, and that portal account is kind of already created, so we don't need to do that since the patient registered themselves. Okay, and then you may need to manually request some forms if that's not automated in your clinic yet. Okay, let me know if that answers your question or if there are any additional questions before I move on from the new intake process. So again, I just want to do a recap of this process and remind everybody that it is written out in those step-by-step instructions that I talked about. But for now, just a quick reminder from here, we're going to press this new intake button, and then we're going to enter all the required fields. Okay, I'm going to show you a shortcut. File, load from existing client. Let's say I have a brother-sister. Okay, I can enter the brother, and then I can copy the brother and just edit the information from the sister by using this load from existing client. When I click that, it's asking me to select a name. Excuse me, I select the client I want to copy, and I just have to update certain things about the account. Okay, for now, I'm going to exit without saving, and I'm going to find an existing patient. So to find an existing patient, that's this binocular button right here. Okay, it's asking me, do I want to abandon my changes? And I'm going to say yes. So we're not saving that patient I just created. I'm just going to grab this existing patient. Okay, but before I do, I just want to show you how to use this find form. The find form works by searching for the last name. So I'm typing that in. I can also use the alphabet letters on the side. So I can toggle, these alphabet letters. There's also this history list, so HX for history, and that's that recent list that we saw earlier. Okay, and my quick list is right here. And then we have discharged clients under DC. Okay, if you don't know the client's last name, you can come here to advanced search. This is one of our tips and tricks, and you can search by things like the first name or last name or both, or the date of birth or the first name and the date of birth, etc. There's also options to add more criteria at the bottom. Okay, if anybody has questions, let me know. I do see one question here. When the patient register on the portal and all of the information is not imported, I assume the front desk staff will have to go in and complete the missing information. That's accurate. Yep, so we would recommend that you have a workflow that has the front office staff review those new registrations to make sure that record is complete. So when they're, I think in your agency, there's like a task that comes up to call out to the client within a certain number of days. They'll want to, review the demographic form first. So you have two options there. You can make them a task to review the demographics that have come in so that they know what to ask the client for, or you can make it part of that client contact task that you're already generating and put it in the instructions area. Okay, I don't want to go into that during this front office training, but if you do have questions about specifically how to do that, we could certainly cover it during one of our meetings. Okay, if anybody has additional questions, let me know. Okay, so we entered that new intake. I'm just grabbing somebody here. We'll grab this client here. Then we went to the patient portal, we created the account, and then we made the form requests. Okay, also in the front office, you may want to know things like how to see who's assigned to the client. I can come here to a staff assignment and see who's assigned. In this case, nobody. If I need to manually create a staff assignment, I can do that here. Okay, we do recommend that your clinic automates this process. So if you have questions about that, your system admins can reach out to us. Okay, you can also enter insurance authorizations here. You can manually enter them for any payer that's listed on the client's account. In this case, I could say, the client wants to pay for 5 sessions before we're kind of alerted to update their financials or something like that. So we could kind of use this NA and say, for the next year, they have 5 sessions that we can have until we need to update their financial information for their sliding fee. Okay, so we'll just close that. That's insurance authorizations. You'll notice that these are changing color, so it's just visual indication to you what the client has and doesn't have. Okay, program assignments. That's more at the intake level, but this is where you can see what programs the client would be part of, and you can enter them here as well. If the client has an ID number, sometimes that happens in like court-ordered treatment arenas, or you might assign program-specific ID numbers. You can put that there. It's totally optional. We can check the date admitted and discharged. So we'll say that this client's admitted to couples counseling today. They may be discharged later, and then I could add in additional program assignments so they can be receiving treatment in multiple arenas. Okay, that's turning green. Scheduling groups, remember I said that we can accommodate appointments where multiple patients are present. If we need to add people into the scheduling groups, we can do that here by highlighting the scheduling group and pressing that arrow to say, move it from unenrolled to enrolled. Okay, now if one of these scheduling groups has a maximum limit, you're going to get this error right here, and it's going to say you've reached the maximum number of patients. Do you want to add them? Say yes. If you don't want to add them, but you want to put them on the waiting list, I can say no, or I can cancel to do nothing. Okay, I'm going to say no to put them on the waiting list. So you can see that status right here. Any questions on this? Nope. Okay, great. So we'll save that. It's just updating any future scheduled events to add this client and save. Okay, we'll stop there and we'll close out. Any questions? Okay, now after a new intake is entered, it's usually a next step to schedule their first appointment, right? So you may have referrals coming in indirectly, meaning from like a referral source, or directly where the client's calling you. Okay, so if, let's say, the client's calling you directly, your next step might be to come here to where it says actions and then schedule appointment. Okay, so this is just a shortcut to either the schedule or the find available appointment tool. So provided your team has their availability configured, we're going to use the search for time slot. And we're going to say this could be at any location or just the main building. Okay, so I'll say any location. It could be any time in the next month. And then I can go ahead and search. Oops, we'll go ahead. Sorry, I need to select my staff and then search. Okay, and then I can see all of the availability that the providers have within this criteria. And I can go ahead and select the available time. It fills in the scheduled event for me, so everything I need filled in. Okay, now these program, service, payer, the program and service may not fill in for you if your administrators haven't filled out the default event values for this provider. My administrators have. Okay, so just keep an eye out for that. You may need to fill this in. Then when you're done, you'll save and close. Okay, ideally at this point, the system will go through and create an appointment record for your clinicians. Okay, and that's going to allow the clinician to kind of go in and make their progress note. So that you can see what that looks like, I'd like you to first take note of this icon here. Okay, so you're going to see in my system, I have appointment reminders. Okay, the appointment reminder in this case is queued up, so it's white. It means it's waiting to go out. Okay, once it's confirmed, that phone is going to turn green. If it's canceled, it will turn red. Okay. Again, ideally, the system's going to go ahead and create that linked appointment for you, provided your system admins have it set up that way. If not, you'll need to do that manually by clicking that Create Linked Appointment button. That's going to bring all of the information forward from the schedule, and it's going to populate this appointment. Okay, what you're noticing is this quick info is popping up for the client. That's because he has an alert here. Okay, so this quick info is one of our tips and tricks. I'm gonna kind of take a sidestep from the appointment and just show you what's available here. Okay, so we have the patient notes here, billing notes, compliance. This is like client due dates. We can see the diagnoses that are assigned, and then any global notes that the client has, or sorry, that the clinic has. So the global notes are not specific to a client. These are like agency announcements. Okay, patient notes are specific to the client. Okay, quick info is just a summary, and then you'll notice you can jump into those same areas we were just talking about. Okay, any questions so far? Great. Okay, coming back to this appointment, we'll just keep moving through. You'll notice a lot of stuff filled in for me, again, because my clinician has some defaults, and it brought over information from the schedule. Okay, you'll notice that this is a required field. So this appointment record isn't going to be able to manually be saved without having this filled in. So I'm just going to put a blank assignment in here so I can save it. Okay, so this isn't necessarily something you would do at the front office. I'm just kind of doing it so we can save this record and go back to the schedule. Okay, now coming back here to this icon on the right of the screen, you'll see that now there's a new icon. It looks like a hand writing a note. Okay, and that's just telling you that there's an appointment record created and it's ready for a progress note. Okay, another thing I'd like you to notice is as I'm highlighting this event, down here at the bottom, the event details are showing. So I just kind of have a quick view instead of having to double click on the event. I see more details just by highlighting it. Okay, I can also right click. So remember to right click things throughout the system so that you see what quick actions are available. We try to make things very quickly accessible to you. Right clicks are your friend, action menus are your friend. Okay, so on the right click menu here, I can generate reminders, I can collect co-pays, I can check the client in just by right clicking. Okay, when I check the client in, it's going to notify the provider that the appointment, that the client has arrived for their appointment. Questions on scheduling the event? Okay, now that time I used the tool called Find Available Time Slot. You can also access it up here on the top of the scheduler. I'll show you how to get back in here and schedule a manual event in a little bit. Okay, for now I'm going to close out of here. Remember, I got in there by going to Actions and then Schedule Appointment and then search for time slot. So it was just a quick action right after I entered the intake. Okay, you can also do this if you're updating. So earlier, Sheila asked about the referrals that were coming in from the portal being incomplete and needing to be filled out. So if you're at the front office completing that and need to now go and schedule the time slot, I've got the client on the phone, I can do that right here. Okay, any questions, let me know. Okay, right now I'm closing out and I'm coming back to the My Clients widget. Okay, so we've kind of covered a lot right from this client's widget, entering a new intake, scheduling events, kind of moving through the client's entire record and sending form requests. So we'll kind of keep moving through these widgets and we'll move over to the My Messages. Okay, you may or may not have all of these boxes depending on what your clinic has enabled. Okay, I'm just going to walk through what I have. So I have messages. These are internal messages. These are HIPAA compliant. So you are able to include client names and PHI. You're also able to include things like a record to a specific form. So let's say I want to reply to this message. It kind of allows me to reply, and then I can select a form link, which allows me to select a patient and the form I want to point out to this user. Okay, let me know if anybody has questions. Okay, reminders, these are user specific. These are reminders I set for myself. I can do that right here under reminders. So I just click this little black arrow, reminder, and then you'll notice I can set the date here and then set up a subject. So if I need to, I don't know, check back on my portal account access, I can set myself a reminder here. Okay, compliance alerts. So if my administrator set up tasks for me to do and I get a message about them, this is going to alert me saying something's coming due or is overdue. Signature requests, these are supervisor signature requests. You probably won't get those at the front office. Same with e-prescribing. Scheduler notifications, if something happens on the schedule where you're a link staff member, like a staff meeting perhaps, you'll get a notification here. Patient portal messages, if you're part of that general group, you'll get notification here, or if you send a form request and it's completed, you'll get that notification here. And then finally, lab requests. You can send lab requests to and from ClinicTracker. Okay, any questions, let me know. I don't see any, so we're gonna move right down to where it says My Schedule. Actually, I'm sorry, before we move on, I do wanna show you, you can click this My Messages button to access the full messages tool. Okay, most people just work off that little widget, but if you prefer, you can come in here and work off this full screen view. Okay, coming down here to the bottom, we have the My Schedule and the My Appointments. And you'll notice I'm just clicking that little refresh button. Okay, that happens every so often, but I'm just forcing a refresh. And you can see that appointment that we just added. Okay, so here's the scheduled event that we added to the calendar. And here's that linked appointment we created by clicking that button to enter the record into the client's treatment history. What I can see here is that the appointment status is pending and the progress note is missing. So the providers are going to be able to see that kind of thing as they're ending their day. They'll be able to, kind of come here and make sure everything got done. They can use this throughout the day to click into the record and create progress notes. Okay, you at the front office, more likely you'll be entering things like the status, perhaps if you're checking the client in, and just making sure their authorization gets entered. Okay, when that authorization is entered, it's actually going to deduct from that authorization we made earlier. Okay, so if I had put in 5 sessions, it will say that the client has 4 left. Any questions on this? Okay. So we've gone through a lot, and I'm going to come back to this main screen. And I'm just going to pause and see if anybody has questions on anything we've covered so far. So we've covered intake, we've covered scheduling an event, we've covered sending the form request. Okay, anything people specifically need to see from here, okay? Let me know in the questions or chat if you have something specific you need to see. We have some time left. For now, what I'm gonna do is I'm gonna go in and I'm gonna manually find a time slot. I'm gonna schedule a group appointment and I'm gonna make it recurring. Okay, and then from there, we'll see what we have for workflow requests and questions. Okay, so I'm gonna come here to where it says My Schedule. That brings up this full scheduler. Okay, this is where I can come in and say, well, I wanna look for something next week. So I'm just clicking on the day. Well, I don't want to look at one day at a time. So I'm coming up here to the upper left. So everybody see where I am, upper left. And I have 1, 5, 7, 31 day views. I'm going to say, show me a 5-day view. Okay, and now I can move through my 5-day views just by clicking on the calendar. So that's 1 week out, 2 weeks out. When I find the time slot I want, I'm just going to double click it. So just double click. It knows that I want it on my scheduler because I clicked on my own. Okay, but if I have a different resource over here selected, I could make it for them instead of me. Okay, see that on the right-hand side. Okay, on here, what I want to do is change this event type. I want to say this is group therapy. That's going to change the color of the event on the calendar. Your clinic may have different values here. Okay, so you'll want to get in tune with your local admins about what you're supposed to pick for what kind of appointments, or have them set up your staff default so it's easier for you. Okay, here where it says link to client, instead of pressing the green plus button, I'm going to use the black little down arrow. Okay, so the green plus button would allow me to select one client. So if I was making just an individual appointment like we did earlier, I would use the green plus. Instead, I'm using the black arrow to have more options. You'll also, before I select group, which is what we're going to do, I also want to point out that you have an option for new intake right here. So you're able to add a new intake from here if your process is find an appointment first and then add a referral. Okay, for now I'm going to go to select group and then search for group. Okay, and then I'm going to select the group I want to use, and I'm going to say anger management group. What that does is it puts in all of the clients who are part of that group. Okay, now I can say it's part of the anger management program. The service is group therapy, and the payers will be patient specific later. And I'll go ahead and create that linked group appointment now. Okay, that brings me to a different screen. If you're taking attendance at the front office as opposed to the clinician taking attendance, you can check people in this way. So we can say they showed up. Okay, there's also a shortcut to mark everybody has showed up, and then I could say, well, this guy didn't show up. Okay, oops, I'll just grab the service and save. Okay, the reason that service didn't come over is because I didn't have that service configured to be part of the anger management program. So that was just a mistake on my end. So I'll click save here, and now that's ready for the clinician to do their progress note. Okay, so we just went through how to manually find an appointment on the calendar, or an available time slot on the calendar, and schedule that event. Now I'll show you how to make this recurring. So this happens every week. I'm going to double click, and I'm going to say recurrence. Okay, and then I'm going to say it's weekly, every Wednesday. And it's going to go on perpetually. So it's just not going to end. So no end date. Make sure you pay attention to your range of reoccurrence because the default is 1, which means it's not going to reoccur. So make sure you update that. Okay, and save. Oops. So I'm just going to walk through that one more time. Double click, recurrence, weekly, Wednesday, no end date. Okay, and then save and close. Okay, so that now is a reoccurrence. You'll notice here that there's another icon. It just is those 2 arrows kind of going in a circle. That's your reoccurrence icon. It tells you that this is a recurring appointment. Now let's say that next week I tell you that I need you to end this recurrence. Okay, I don't want to delete this. I want to right click it and end reoccurrence here. Okay, if I need to make any changes to that reoccurrence, I want to right click and end the reoccurrence here. Okay, we talked about recurrences, how to end them, how to change them. You would end it and create a new one. Okay, so far we've covered a lot. I don't see any specific requests or unique requests. So I'm going to show you the last thing I have. Go ahead and get your just system generic questions, ClinicTracker, Billing Tracker questions typed in. Raise your hands if you have them, and we'll get ready for that. Last thing I'm going to show you as part of today's scheduled topic is the staff Staff Task Dashboard. This is where you can come to see everything that's assigned to you based on system automations. So during your implementation or after, your clinicians ideally will have implemented workflows where you're receiving tasks to do things. A common one is after a referral, send out release of information. Or reach out to the client if you're receiving kind of third-party referrals. Okay, no matter what the task is, it's, if it's clinic specific, it's going to be available here where it says Staff Task Dashboard. Okay, and here you can look at your pending and completed tasks, or I can look at things without a due date at all. Okay, so I can look at pending tasks that are due by the 20th. For myself, I'll just say, so I'm going to leave this drop down alone altogether, and the staff member says Alicia Bizio. Now, you may only have access to yourself. You may not have admin privileges like I do. Okay, and then you can click search. Okay, there's additional optional criteria over here. I'll let you play with this on your own. I don't use it a ton. I just look at all of my due dates all at once. Great question, Amber. If a client is self-registering, is there a way to have them upload a copy of their ID, insurance card, or credit card? This actually kind of ties into what we're talking about here with these tasks. The workflow builder can actually send out forms. So you can create a form that says, give us your ID, your insurance and credit card, we need to see copies of all that, or, that kind of thing. Once they register, you can have the workflow builder automatically send that form request, or the front office can send that form request if you're not to that automation point yet. Then when it comes back in, we can generate a task for the front office to review the information and update the applicable areas of the system. So let me know if that makes sense to you. But those tasks would come right in here once the workflow is triggered when the client is sending the information back. Okay, Amber, let me know if that makes sense or if anybody has questions. Is there a way that we can add that insurance into the insurance tab where the picture of the card is typically stored? Let's talk about that in a second, Amber. So we'll place a hold on that for right now. And we'll just finish talking about this task dashboard. So on here, this is where all of your tasks are going to come from the clinic. This is where you can right click and mark it as complete. So naturally, the system's going to see what you're doing. If this task is for locking of a progress note, which wouldn't apply to front office, but you might have like creation of a collateral. Okay, so I'm just going to double click. That's going to take me to where I need to go. As soon as I complete that action, the system's going to mark the compliance item as complete for me. Okay, if I already did it, and now my clinic is implementing all these rules and I need to manually mark it as complete because I already did it before the rule was triggered, and it's just kind of one of those weird transitional things, I can right click and say mark as complete. It's just going to ask me to, add the completion date. So I can backdate this if I had completed it a month ago. And I could say, completed prior to rule, just so the auditors know why I manually marked it as complete. I'm just going to say test for the sake of time. Okay, and that gets rid of that task, and I can kind of keep going through and working through my tasks. Okay, so this is just a nice handy way. You're not obviously going to have so many built up, but this is a nice easy way to see what's assigned to you, and you can work through your day just by double clicking and kind of working through each item. Okay, let me know if anybody has questions on that. Otherwise, we'll move over to the form builder and I'll answer Amber's question. I don't see hands up and I don't see questions being typed, so I'm going to move over just because we have a few minutes left. But if you have other questions, ClinicTracker or Billing Tracker related, please go ahead and type them in or raise your hand so we make sure we get to them. So here I'm going to Utilities and then Form Builder. Okay, and then Form Builder again. Okay, and then in here, what we have is just some forms that are created in my test system. I'm going to just grab a form that's already created by double clicking. Okay, and if you haven't had Form Builder training, there's a lot of really good webinars. Just search our previously recorded webinars recording, or reach out to the support team and they'll send you the recordings. There's several that are good. And then if you need help from there, you can schedule a time with us. Okay, but for Amber's question, she's saying, is there a way that we can have a picture of the card? So we can do this file attachment to create the cards here, to collect the information about the card. In this case, when the information is collected, then what you'll need to do is on the insurance area of the demographics is just grab the saved file and link it in. So there's not a way to kind of make that automatically happen right now, but that is something I can suggest. Okay, we do have a tool similar for other pieces of information other than the file attachments. And I do want to show you that, Amber, since we're in here, and anybody else who finds interest in using a custom form to update the demographics form. Okay, so I think, Sheila, this might apply to your agency, maybe Tony, that might apply to you, and Ebony, perhaps you. So there's a lot of you this could apply to. You might want to just have a form that the clinician or the front office can use that updates the demographics form. So there's actually a new property that we just rolled out. It's in what we call beta, which means we're asking everybody to use it, try it out, test it, let us know if you have any problems or suggestions. Okay, so if you do have time, please play with this and let us know how it's working for you. If you do have, find a bug, let us know. Take it as a challenge. We love it when you can find those problems in the beta phase. So this reference controls new beta. This is where we can type in demographics. Oops, sorry, I have my caps on. So then I can kind of see what's available. Let me just try this again. Okay, so I have demographic info. It's because I had the S at the end. Demographic info, and I can just scroll down and see what's available. This is where I typically use that F2, and now I can see everything. And I could search for like name if I was trying to have the client's name here. So like client intake first name. Except now one more thing, this is going to pull the client name forward and it's going to display it in this field. But if I wanted to also update that same field, update the demographics record, I have the ability to do that now. So it says right back to reference and I can change that to yes. Okay, so everybody, we are asking you to give that a try. Let us know if you do have any problems with it. And then if you had any specific use cases you wanted to discuss with me, we could certainly schedule a time, let us know. If you want a recording of this training, which a lot of people are starting to ask for in the chat, you can come to the user portal. On the user portal, under the ClinicTracker Community Training Series, we have this previously recorded webinars page. It does take a second to load. I apologize for that, but give it a second and you'll be able to search for the recordings. If you're having trouble finding it or you're just really busy and don't want to search, that's fine. We know off the top of our heads which ones are good for certain topics. So certainly just reach out to the support team and they'll send you some links. They're happy to point you in the right direction. Now remember, after you review those previously recorded links, if you have questions or you want to schedule a webinar that's like more specific, like after you watch the form builder, perhaps you want to look at a webinar of how you can build a specific type of rating scale. You would want to send us a support ticket and just request that webinar or send us your questions. We're absolutely here to help and make sure you get the information you need. So make sure you're using your resources, okay? Call us, carrier pigeon, support tickets, emails to us directly. We're really happy to help. Yeah, so to answer the question, this previously recorded webinars, this is where all of our previously recorded webinars are kept and they're broken out by category, like you see here. Okay. Now, the recordings are kept, I guess, until they're deemed out of date. So we might keep some older ones, like you see there's some from 2020. Okay, but they're still applicable. So we might keep them around, but we'll weed them out from time to time. Okay, we are right at time, but if there aren't any additional questions, please do send them in through the support portal. We're here to help you. Please don't wait until you're frustrated. Just reach out and we're happy to walk you through anything that you're having trouble with. Remember to check the user portal. There's a lot of great information in here, and certainly request training as you need it. Okay, great. Now, if you found this recording helpful, please do share it with your staff. Reach out if you need more specific trainings. We're happy to work with you on that as well. Okay. Thanks, everybody. Have a great weekend. We look forward to hearing from you. Let us know if this webinar was helpful. Send in a support ticket and just let us know that you thought it was great. Thanks, everybody, and have a great day.